A very good evening to all of you. Today we will be doing pathology. Pathology has 25 to 30 questions in the NEET PG exam. E- Even some of the questions of medicine and surgery can be easily answered if you have a sound knowledge of pathology. So please concentrate on this subject. So let's begin with the first question. Michaelis Guttman body are seen in A. xanthogranulomatous pyelonephritis, B. malakoplakia, C. nail patella syndrome, D. none. It is malakoplakia. What is malakoplakia? Malakoplakia is a variant of cystitis. It is related to chronic bacterial infection, usually caused by E. coli and occasionally by Proteus species. It is characterized by unusual appearing macrophage and giant phagosome. It points to defect in phagocytic or degradative function of macrophage. It is a peculiar pattern of acyclic inflammatory reaction, characterized microscopically by soft, yellow, slightly raised mucosal plaques 3 to 4 cm in diameter. Histologically, it is characterized by infiltration with large foamy macrophages with occasional multinucleate giant cells and interspersed lymphocytes. The macrophage have an abundant granular cytoplasm and the granularity is PAS positive. In addition to these histological changes, malakoplakia is also characterized by Michaelis-Guttman bodies. Michaelis-Guttman bodies are laminated mineralized concretion resulting from deposition of calcium in the enlarged lysosomes. They are typically present both within the macrophage and between the cells. They demonstrate positive results using PAS10 and are diastase resistance. So the correct answer here is B. Malakoplakia. DIC is seen in A. Acute promyelocytic leukemia, acute myelomonocytic leukemia, C. CML, D. Autoimmune hemolytic anemia. The correct answer here is acute promyelocytic leukemia. Acute promyelocytic leukemia. Disseminated intravascular coagulation is associated with promyelocytic leukemia, that is acute promyelocytic leukemia, AML M3, constitutes 5 to 10% of all cases of AML. Liquefied necrosis. Liquefied necrosis, if the question is asked, simply look for the brain option and it will be there. So correct option here is B, brain. Please click the link in the description box to join the 2-day NEET PG Ultimate Breakthrough Blueprint event. Just click the link in the description. It's absolutely free for you and it covers all the 19 subjects in a most holistic manner. It will take your preparation to the next level. Students all over India are participating. You also join the masterclass. Flare interpol response is mediated by A. Axon reflex, B. arterial dilatation, C. histamine release, D. local hormone. It is axon. Cystic medial necrosis is seen in A. Marfan syndrome, B. Friedreich's ataxia pattern, C. Down syndrome, D. Kawasaki disease. It is Marfan syndrome. Causes of constrictive pericarditis are TB, SLE, brucellosis, D, A, and B. It is both TB and SLE, so it is both A and B. That is the correct option here is D. In cell death, myelin figures are derived from nucleus, cytoplasm, cell membrane. So the correct answer here is cell membrane. Enzyme that protects the brain from free radical injuries. It's absolutely superoxide dismutase, which it has an antioxidant mechanism. Fat necrosis is common in momentum breast entrepreneur. Yes, wherever it is fat necrosis can occur. So all of them. In apoptosis, cytochrome C acts through A, APF1, BCL2, FADD, It is APF1, which is activated for nuclear fragmentation in apoptosis. A, caspases, B, APF1, C, oxygen free radical, D, all. It is caspases. Annexin V is a marker of A, apoptosis, B, necrosis, C, atherosclerosis, D, inflammation. It is apoptosis. Which of the following markers is specific for gastrointestinal stromal tumor? It is CD117. Multiple epidermoid cysts are seen in it is seen in Gardner syndrome. The features of Crohn's disease are all except lymphoid hyperplasia. Female is affected, male is not. The disease is autosomal dominant. What is the chance of children? It is 50% affected. The inheritance patterns of familial retinoblastoma is autosomal dominant. Male-to-male transmission is seen in autosomal dominant disease. which is not a feature of Down syndrome. Pink connected birthmarks. Lines of John coralliform thrombus. Anemia with reticulocytosis seen in hemolysis. Maximum spirocytes are seen in it is seen in autoimmune hemolytic anemia. Anemia associated with leukemia is myelocytic pneumonia. Anemia. Chemotaxis is mediated by leukotriene B4 and C5a.